Hi everyone. Before we start our discussion, we would like to give you a quick updates on our services. Yashoda Hospitals provides the convenience of having doctor online consultations. You can now talk to our doctors across all specialties from the comfort of your home. We also have a free COVID-19 chat option available on our website www.yashodahospitals.com. Let's start our discussion now. On behalf of Yashoda Hospitals, we are happy to connect you with our doctors via Facebook Live. Today's topic is how to protect the elderly population from COVID-19. We have Dr. Vijay Kumar, our consultant physician from Yashoda Hospitals, Secunderabad. Doctor, thank you so much for being here.
Yeah, thank you. Same here.
Doctor, over a few months, the data is clear that the elderly population are at an increased risk for COVID-19. Let us address the major concerns for elderly and their loved ones. Doctor, can you tell us quickly who are the elderly population?
Yeah, at the outset, I'd like to tell you that no event in history has shaken the world like this. And we are in for a long haul. At least it'll take a year before things normalize. So we need to follow these generalized guidelines and instructions for a year or so. That's the conservative estimate. And as you have already said, world over, as we see the data, COVID-19 is affecting more often the elderly, and more often the mortality or death rates are higher in elderly. So elderly population is typically described in our country as those who are above 65 years, in Western societies above 70. But for this COVID-19, as far as India data is considered, anybody above 60 years have to take these guidelines seriously.
Okay. Doctor, why are elderly population at high risk for COVID-19 infection?
Yeah, in nature, any species has a definitive lifespan. For example, if you take a dog, it is 10 to 15 years. For human beings, it's about 80 to 100 years, depending on where he is, which continent he is. And during the course of the time, as we pass through childhood, adults, and young adults, the body tends to get old a bit. That includes each cell and each organ. So as we get older, the function of an organ becomes diminished. The reserves in a particular organ has to take any particular insult in the form of an infection or anything else. It's much less compared to younger population below 60 years. And it also holds good with immunity. As we age, the cell-mediated immunity or the antibody response to a particular infection is definitely much less compared to the normal young people.
Okay.
Yeah.
Doctor, why do most of the deaths reported due to COVID-19 seems to be in elderly population?
Yeah, this again, as I said, there's diminishing reserves in the organs. In addition, as we get older, certain things add up. Like, for example, we tend to get blood pressure, or we can tend to get diabetes, or we tend to get other respiratory problems, chronic respiratory diseases, kidney diseases, liver diseases. These all add to the morbidity of the elderly. In addition to age, these factors get added. So as we have seen in the data, elderly age group, if with one comorbid like hypertension, the risk increases by threefold. If they are combined together, they have cardiac issues, it increases ninefold. Similarly with respiratory diseases, similarly with kidney diseases, liver diseases, these are added on. One more problem is some people tend to gain weight after menopause. And we have seen data that obesity and COVID-19, the mortality or the death rate increases exponentially.
Okay. Doctor, what should an elderly person and their caregiver ensure during this lockdown?
Yeah, there are a few things. There are certain differences when compared to young people. One of the common things which we are advocating now is social distancing. That's a bit difficult in the elderly because we have seen that most of the problems, mortality rates increase if the elderly person is isolated socially. Even the neurological problems, the cognitive things like memory, routine behavioral things also deteriorate if an elderly person is totally isolated. So for elderly person, it's physical distancing more than social distancing. They have to maintain the distance, stay in their own room, And if a new visitor comes, it better not meet them. If he has to meet them, at least 1.5 to 2 meters gap should be there. And he should be wearing a mask before they meet him. And they should not do handshaking or embracing, especially with grandchildren. They have to be more careful because children, even though they are affected, they are very asymptomatic and they have very mild symptoms. For every practical purpose, they look normal, but those people go to school and come back. Those are the main people who are likely to give infection to their elderly if they come into touch. These are the things as far as social distancing is concerned. It's more of physical distancing. Then they have to maintain their hygiene, to take daily bath. If they can shave, and frequently hand washing. Hand washing is one thing. Soap and water is ideal. If soap and water is not able to move regularly to the basin and other things, then you can use an alcohol-based hand sanitizer, especially before eating or before doing anything or before touching, especially the knobs, the phones or whatever. Before that and after that, you should be doing this hand washing, which is important.
Okay.
And it's always better to avoid outside things like newspapers, magazines, and other things. If some parcels come also, it's better to keep them outside for about a day or so before touching them. And again, hand washing after touching them is more important. Hand washing technique, as you know, already many people have told you, but you have to wash at least for 20 to 30 seconds before you touch your nose, mouth, face, or before you eat or anything. If possible, avoid touching your nose, mouth, and eyes as much as possible.
Okay. Doctor, are there any COVID symptoms and disease progression specific to elderly population?
Yeah, definitely. Sometimes the presentation is slightly different. So the common symptoms that is associated with COVID are cough and fever. In Indian patients also, we have seen cough and fever as the primary presenting complaints. But in elderly people, sometimes fever may not be appreciable. So they present most often with some cough and some GI symptoms like lack of appetite or some stomach pain or loose motion or extreme weakness or fatigue or loss of sense of smell or sense of taste. These are initial things. And one more important thing, daily you know what you are. If you see any mild changes in your ability to do the routine things, that itself is a symptom for you to inform your caretaker.
Okay. Doctor, what are the preventive measures for elderly staying alone?
Yeah, staying alone is a big problem again. So the most important first step that they should take is they should note down the telephone numbers of their caretaker, of their regular doctor, and the helpline 104, and they should put it on speed dial so that they'll be able to access them easily. So communication is the key. Again, as I said, self-isolation for a single patient living, more often detrimental mentally and other aspects. And we have seen that isolation totally leads to increased mortality. So they should keep regular touch with their near ones over phone or video calling, and they should be able to read books or develop new habits, whichever they are, either in the form of video games or be occupied in some other like minimal gardening or something, whatever they are able to do. So they should be able to maintain a lifestyle wherein they are totally occupied. They should not be sitting brooding about other things. So positive vibes are important. And being in contact with their near ones is also important. As you said, speed dialing is important. For all elderly, the routine OPD checkups should be avoided. And most of the hospitals now are providing video calling and telephone facilities. For routine checkups, it's always advisable to consult your doctor on phone or video calling. Don't go to the hospitals. And routine procedures like elective procedures like cataract operation or knee replacements, things like that, they can wait. So you can wait and get them done later once the situation goes down. There's no urgency for things like that. Yeah,
Okay. You mean to say that instead of regular checkups going to a hospital, instead of that, you can skip it and you can go for online consultations as well.
that's right. The doctor will tell you if you need to come into the hospital sometime. But if there are any tests needed, also you can get it locally done and show it to him on video call. Then you can follow it up. If the doctor feels necessary that you should come to the hospital, then he'll instruct you accordingly. Yeah.
Okay. Okay. Doctor, what are the treatment options available for elderly people infected with coronavirus?
Yeah. As of now, as you know, there's no known treatment till now for coronavirus worldwide for any age group. So the treatments available are all empirical, based on previous knowledge of previous SARS-CoV or MERS-CoV, previous knowledge of the medicines available, which have been there for other reasons. So those are the things which are being tried. For a younger population, those particular medicines have lesser complications and lesser side effects. So for elderly, if you are using these medications, you have to be extra careful. You should not self-medicate. It's always under a supervision. And those medications are better given in a hospital. And as I said, elderly people are more prone to require oxygen requirement or ventilator support. So those things are taken care in the hospital. Elderly age group, it's better not to self-quarantine for a long period of time. If you're not feeling well for 2 or 3 days, it's better always to consult your doctor and visit a hospital.
Okay. Doctor, let me quickly take you across the comments, the questions posed by our viewers. Doctor, what's your best advice for people over 65 in dealing with this outbreak?
The best advice, one is they should change their lifestyle a bit. And as I said, physical distancing is important. If somebody visits you, maintain a distance of 1 to 2 meters at least. Wear a face mask and frequently hand wash. Avoid totally newspapers and magazines which come from outside. Avoid touching parcels and packs which come from outside at least for 24 hours. So maintain cell numbers of your close ones, caretakers, or helpline number 101, and try to be physically active. You should do walking on whatever steps, or you can do yoga. These are important. Proper sleep is also important. 6 to 7 hours of sleep really recovers the organs. You will be able to better face any situation. And proper meals. That you should be freshly cooked hot meals every day, if possible. And hydrate yourself regularly. Lukewarm water is preferable. Don't take items from fridge or anything. So regular sipping of lukewarm water is advantageous. And try to take more vegetables and more fruits, which are useful. Elderly, one more thing they neglect is protein intake. So take more of dry fruits, more of pulses. You can eat egg. These are also important. These also help you in dealing with that. There are certain deficiencies that come in elderly. One of them is vitamin D deficiency. Consult your doctor and take vitamin D as much as they advise you. And any zinc containing vitamin is important, but because that increases immunity. And even vitamin C increases immunity. So consult your doctor and take these supplements, which are also very important. And especially so if you are above 65.
Okay, doctor, one more question. Elderly with problems like BP and diabetes have regular follow-ups. Should they postpone them during this lockdown period?
Yeah, the mortality, as we said, increases with if you have additional risk factors like blood pressure and diabetes, respiratory diseases, renal or liver diseases. So control of your blood pressure and sugar is important. If you are able to monitor your blood pressure at home with a blood pressure monitor, inform your doctor, he'll adjust the dosage. And similarly for diabetes. If you are not able to manage at home, probably you can call somebody, pathological lab to home, get it done and inform your doctor. If the blood pressure and diabetes are under control, it's better not to visit a hospital. You can consult your doctor on video calling or telephonic facility. If the BP or sugar doesn't get controlled, if it's not under control, then probably in consultation with your doctor, you can visit him at the hospital.
Okay, one more question. Is it true that older adults face an elevated risk from this coronavirus?
100%. World over, we have seen the risk for people below 55 years is about 2.5 to 3%. And in elderly, it is varied from 10 to 28% mortality in various countries. It also depends on not only on age, but age plus other risk factors. If they are present, the mortality increases almost tenfold when compared to a younger patient.
Okay. Doctor, should elderly limit or avoid routine trips to doctors during this time?
Yeah, 100%.
This is...
Yeah, it's all repetitive, but again, I would like to tell you, for routine consultations, routine OPDs, don't visit your doctor. Do a telephonic or video calling. Depending on what your doctor feels and decides, you can decide visiting the hospital.
Okay. One more question. Should children, friends, or caregivers stop or restrict visits to older people while this situation remains volatile?
Yeah, as I've told you, children should definitely avoid close contact, handshaking or embracing, because as I said, asymptomatic mild infections are more common in children. They usually do not present with symptoms. It's a simple mild cold or cough, mild fever, they'll be all right. And these are the people who are reservoirs for transmitting the virus if they get in touch with elderly people. So children are the worst, but all caretakers, whatever age group, they should maintain this social distance. They should wear masks when they tend to meet them. And the clothes of the elderly should be washed differently. The items that are used by elderly like soap or paste or toothbrush should be different. Even the bucket or whatever it is should not be mixed with our things. And any outside substance should not be allowed directly to go to him. At least 24 hours gap should be there before you present it to them.
Okay. Doctor, before we conclude, can you please quickly take us through the precautions need to be taken by this elderly population?
Yeah, elderly from their side, so personal hygiene is very important, like daily bath and hand washing for 20 seconds before you eat or before you touch anything or after touching again, or like doorknobs, cell phone, dining table, routine table, whenever you touch, you have to wash your hands at least for 20 seconds with soap and water. If it's not available, then hand sanitizer is okay. But soap and water is the best for washing. And avoid things which come from outside like newspapers, magazines, etc. But try to be active within the confines of wherever you are, like walking, doing yoga, reading books. Try to be more conscious and go on a news diet. You don't continuously put on the news channels and go through the data every half an hour. Probably it suffices if you take morning watch for 10 to 15 minutes, night 10 to 15 minutes should be fine, because otherwise the anxiety levels and other things might definitely harm you. And take the medicines regularly that are given for other things like BP, sugar on regular basis. Don't skip them. Control your blood pressure and diabetes particularly well. And try to be active and positive. And slightly, those people who have depression or anxiety, it needs to be, the caretakers need to take a better role. They should be in constant touch with them, give them positive vibes, and get in touch with them on phone at least every 1 hour or so to make them comfortable.
Okay. Thank you so much, Dr. Vijay, for being here.
Thank you, ma'am. Thank you. Same here.